Do you know why paper cuts are so painful? This is because at microscopic level, paper is actually quite rough. A knife makes a straight cut, but a paper acts like a saw blade and does more damage to the cells and nerve ending. Paper also leaves behind tiny fibers and chemical residue, irritating the wound even more. Now, there are important questions that you need to ask your patient before making a diagnosis. Firstly, you need to ask your patient about when did the injury occur? Did it occur at work or how did it occur? In case of injury to the head, was there a loss of consciousness? Was the injury contaminated by the feces or soil? Whether there was an animal and what kind of animal or human bite? Whether you have any numbness near the injury? Whether you have difficulty breathing if it was a deep wound to the chest or abdominal pain if it was a deep wound to the abdomen? Secondly, you should know if your patient has history of any of these conditions such as diabetes, bleeding disorders, heart disease, immune system disorders, organ transplant, and domestic abuse in home. One more very important question that you need to ask your patient that if he or she is taking any of the medications such as blood thinners and steroids because these medications may increase the risk of bleeding. You also need to ask when he or she last remember having a tetanus shot. Now, you are well aware of symptoms of your patient. Your main role starts here because you have to examine the patient. Well, this physical examination includes vital signs such as temperature, blood pressure, and pulse. Examine the injury for size, crushed skin and bone, dirt or other foreign matter, sensation and movement of body near injury. You need not to order any blood test unless the injury is very deep and severe or other associated problems. Your patient may need to have a tetanus shot or any other shot such as rabies or to prescribe any antibiotics. So now you are clear about your findings. You can manage your patient accordingly or do further investigation if required. For such informative videos, keep watching sqadia.com.